KSMQ Health Connections, local healthcare providers answering your medical questions. This week's topic, we are what we eat.
Good evening and welcome to KSMQ Health Connections, where we connect you with some of the finest minds in the medical field. I'm Eric Olson. Thanks for tuning in live here on this Tuesday night in Austin. The holidays, so we got you through Thanksgiving. Now we're going to talk about dieting, but we're going to learn a lot this half hour, I promise. Holidays are coming. Of course, December's very busy with family reunions and Christmas and the like. A lot of us are thinking about how to get through the next few weeks without adding a few pounds. Tonight we're going to talk about healthy eating, not just during the holidays, but year-round. And we're going to talk a little bit about dieting, what works, what doesn't, and why. The health implications are, no pun intended, huge. We have been getting way heavier over the last 20 years as a nation. In the year 2000, just over 30% of American adults were obese. The latest statistic from the Centers for Disease Control, 39.8%. And that's obesity. Another 31.8% of us are overweight. Add those numbers up and it means more than 70% of Americans need to lose weight to be healthy. But as we know, doing that is not easy. Approximately 45 million Americans go on a diet every year. 1 in 6 overweight adults are successful with their diet, most are not. One secret to success, losing weight slowly. We're going to talk about that with our expert tonight. Those of us who lose just 1 to 2 pounds a week tend to be the most successful. Now, in a few moments, we're going to talk to an expert who might be able to help us take your calls, because when it comes to dieting, most of us admit we're not that great at it.
Have you ever been on a diet?
Yes.
And can you tell me about it? Did you lose weight?
Yeah, I think for like the first 2 weeks, but I feel like after that, your body just kind of stops. I don't know. I don't really work out much, so I feel like if you don't diet and exercise, it doesn't really work well.
How many pounds did you lose?
I believe about 5. My goal is to get back to the gym and start looking at that a little better and, start getting on a program.
We cannot resist the temptations. Like there's some piece of cake, there's some desserts, some pastries that you know that you don't have to eat, but you still are doing it. That was my problem. That's why I couldn't lose too much weight.
Have you ever been on a diet?
Yes, all my life.
Okay. And so, and how did it go? Did you lose any weight?
I did, but then I gained weight again. So it depends on the diet I'm on.
Have you ever been on a diet?
Yes.
And how did it go?
It's gone well, it's gone badly, both ways.
And what would you do like to improve it or change? What would you change about it?
Well, I think the last one I did was the Whole30, which was great. And it was just staying off of sugar and grains and caffeine and eating whole foods. And that really worked for me.
Some experiences there. Let's start the conversation. Do you have a diet that worked, but you're not sure why? Call us and tell us about it. Did you lose 10 pounds, then gain it all back, even though you were counting calories? Maybe you're tempted to try supplements that you think just might work. If you're watching us live on Tuesday night, give us a call, fire off an email. We have several registered nurses ready to take your questions and comments and pass them on to our guest, who knows a thing or two about healthy eating. Kjersten Nett, registered dietitian, nutritionist at Mayo Clinic Health System. Welcome.
Thank you for having me.
You are a popular person probably the holiday time of year.
Oh yes, people love to talk to the dietitian on holidays.
And we were just talking beforehand though, you have to take a long approach to it, and that is tough. It's hard for me because I want results, like I want to see them right now. And you see a lot of stuff on television that makes it sound like you can get, of course not KSMQ public television, mind you, other stations, that you can lose weight fast and, no pain, no gain, all that stuff, but you are an advocate of the long approach.
very much so. From working with a variety of clients, just taking the slow and steady approach, it's easiest on your body, it's easiest on it's the best long term for you.
And what are the big ones now? Is there one that's very popular? We heard one of our viewers talk about one they were using. What's the latest one? Is there one?
The latest diet would probably be the Ketogenic Diet, or very closely related would be like the Atkins or the Paleo Diets. So these diets focus on reducing your carb intake or like your energy molecule intake to almost extreme levels. So that's cutting out a lot of grain products, that's cutting out dairy, that's cutting out fruit even, and some vegetables even that are higher in these energy molecules.
Would that be something you'd advocate? Is that a healthy way to go? Or?
Well, the ketogenic diet itself, it is approved for adults and children who have epilepsy, but for the average adult, this isn't recommended so much, just because it is fairly restrictive, and restricting yourself from these foods can cut back on how many vitamins and minerals that you get from these foods.
And let me understand this. I would assume there's a lot of self-diagnosis when it comes to dieting. In other words, I think I'm overweight, I see something on TV and I'm going to jump and try it. But you probably deal with people who are medically, like they've gone to a doctor and the doctor says, you need to do thus and so.
Yes.
So there's really kind of two different types of patient or people that are trying to lose weight. Mm-hmm. Mm-hmm. Do you see both of those kinds, or mostly referred, there's a medical reason?
Typically, there's a medical reason. So in order for somebody to come in and see me at the clinic, they have to go to their primary care physician and get a referral. So the doctor can still make a referral if somebody isn't clinically overweight or obese, but just wants to talk about nutrition as well.
You hear that a lot of the ones you see on TV, the so-called like fad diets, mm-hmm. they aren't that successful. Do you have statistics on that, their efficacy?
Unfortunately, I don't.
It's got to be high that they don't. I've heard mm-hmm. that they don't work, or you can't do it long term.
Yes,
for
unfortunately,
a lot of them.
That tends to be the general consensus. Is a diet is associated with a short-term solution to what is a long-term occurrence. So these diets, you follow a certain criteria for a couple months and you're good to go, when it doesn't really teach you how to maintain your long-term habits.
So how do you work with a patient, a new person comes in?
Well, I like to know how they're already eating, kind of meet them where they're at, and just make little small suggestions to their diet on how to improve it. Maybe have them talk to the doctor about exercise, just little changes to what they're already doing over time.
And we're talking long period of time.
Yes, yep.
What's a healthy amount of time to be measuring your weight? Is it good to like weigh in yourself every day or something like that?
I hesitate to suggest every day, just because sometimes it becomes almost an obsession. Just looking at your weight every day, day in, you become very focused on the scale, when I like to focus on the health habits, and typically the scale follows suit.
Okay. Well, we're already getting calls, and you can call our number. It is 888-255-0121. And as we mentioned, Jen Gallagher's along here. She works at Sacred Heart Care Center in Austin, graduate of the nursing program at Riverland. Hi, Jen. How you doing?
Doing great tonight. Thank
all right.
you.
What do you have for us for a first question?
Well, I have a question about protein. It's from Jose here in Austin, and he's wondering how much protein does the average adult need in a day? And piggybacking off that, what about an adult, teenager who is in athletics? I know, do they need increased protein than what the average needs?
So a teenager who is exercising does need some more protein, but it really depends on what type of exercise that they're doing. Like say if they're doing like weight training, they will probably need more. than like a lower intensity exercise, like just walking. As far as adults go, typically you take your weight in pounds and divide it in half. However, this can be slightly skewed. Somebody who is considered medically obese, that protein amount is going to be too high. So then you just you reduce it.
It's math. It's math thing.
It is. There's
okay.
a lot of math. It's very individualized. Your needs are very, very individualized.
That's where I was going with that. And let's back up a minute. That's great information, but why is protein, why is that a focus? Protein versus carbohydrates? What is that all about when you're talking about a diet?
Gotcha. So a proper diet has a balance of proteins, carbs, and fats. So I know the low fat diet was very much that was another kind of fad diet for a while. But your body does need fat. Like you need it for like the padding. You do need padding. So just having a healthy balance.
And I guess the diet, these fast loss diets, I suppose they would tell you, we get you to a certain point, and then you should consult and think long term. I mean, I just look at some of the restrictions on some of these diets, and I think, would I do this forever? I mean, there's no way. I mean, I could see myself 6 months from now, and, I'm not going to be that restrictive, so it's not going to work for me. But what they're probably saying is you need to do both. I don't.
Yep.
You get down to a weight with one of those diets and then try to eat properly, do a little exercise more, those lifestyle changes you were saying.
Yes, exactly. Yep. So really that's why we focus on the lifestyle changes, because making those small adjustments in order to get the results, those are habits that you maintain to maintain that proper weight.
And yet, are you supposed to write them down? Like write everything down, like what you eat? I know there's computer programs or on your phone. Is that important to chart what you eat?
It can be. Like a lot of things, writing down what you eat or using like applications that
a phone app or something?
Exactly. Yep. Using something like that. That we use that as a tool, just to kind of keep in mind how many calories you're eating, because that can have that has an effect on your weight. Like, but yeah, it's a tool. Like, you just want it to kind of keep in mind like what you're eating and your habits.
Talking to Kjersten Nett from Mayo Clinic Health System, getting lots of good information about dieting. She's a registered dietitian, nutritionist at Mayo Clinic Health System, and this is KSMQ Health Connections. We're talking about dieting and how to get it right. How many diets have you tried? How many have worked? Does your work and home schedule make it impossible to avoid fast food? That's a toughie. Do you have questions about good, bad fats, types of foods we should be eating more often? Well, our phone number is 888-255-0121. Email address at the bottom of the screen. Give us a call. And Jen has a call for us.
Yes, hi. Libby from Albert Lee called. She is wondering, it's kind of on the flip side from dieting, but she's curious. She's been losing weight. She's in her 50s, just kind of a steady weight loss. Doesn't really seem to be any reason for it, but she's just wondering, what's the best way to gain weight if you're looking on the other end of the spectrum?
That's an excellent question. So really, some of our first strategies would be to if you're not eating snacks, adding snacks during the day. Also, sometimes it's easier to drink your calories. So if you're steadily losing weight, like sometimes like Ensure drinks or like creating smoothies or something like that can be helpful in gaining some weight. Also, eating foods that maybe contain a little bit more protein and fat in them. So like peanut butter and cheese and foods like that, they can be helpful in adding calories to up your weight.
Now,
but another great idea is just talking to your doctor too, because if this is unintentional, there might be something else could be happening too. So it's really good to keep your doctor in the know as well.
Oh, that's a really good point. Do you run into many of those patients in your practice?
Occasionally, yes. Yep. I would say probably patients looking for weight loss are more common than weight gain, but of course both still occur.
Jen, take her away.
Yes.
What do you got?
Okay. So a question coming in from Clarks Grove, wanting to know just general, what are the most common nutritional deficiencies that you see, and are supplements appropriate at some point? And if so, when do they typically say that?
Supplements.
Okay. So as far as diagnosing nutritional deficiencies, that really comes from your doctor. The most common ones I know in developed countries are iron and vitamin A. Those two are pretty common, just because they're not found as much in the processed foods. That's pretty typical of Western diets too, is more processed foods. In some cases, supplements should be considered. Again, you'd have to go to your doctor. But also just talking to your dietitian too, and talking about like what are some food sources of these vitamins and minerals too.
And you're talking about vitamins and minerals as supplements, not necessarily the weight loss stuff that you see out there. That's not what you're recommending there. I don't know what they're called, the brand names of them, but you know, those kind of things. That's not what you're talking about there.
Nope.
Jen, take her away. You've got another viewer call.
Yes, we do. We're blowing up tonight. Molly from Lake Mills just called. She is wondering if it's possible for vegetarians to get adequate iron just from their diet.
Oh, yes. Yep. So iron can be found in a lot of green leafy vegetables. So you would have to eat quite a bit of these foods, but it is very much possible through a balanced diet for vegetarians to obtain
Is
enough
that
iron.
where a supplement might come in?
Yes. Yep. Again, go to your doctor first, though.
Okay. Okay. Jen, another question?
Yeah. This one, someone is wondering, what foods would you suggest that this lady could incorporate into her diet that would have the most impact on her health? She didn't specify positive or negative, maybe on both sides.
So I suppose as it relates to weight loss, I guess.
Okay.
Yeah.
Under that context, I would definitely make sure you're eating your fruits and vegetables. So fruits and vegetables, of course, your mom always told you to eat them growing up, but they contain a lot of vitamins and minerals that you need at all ages and stages. They also contain a lot of fiber, and fiber helps keep you full.
Oh,
So,
okay. Didn't know that one. Thank you. We have about 7 minutes to go. Still time for you to give us a call with your questions. That phone number, 888-255-0121. And you can email us as well at healthconnections@ksmq.org. All right, we're back talking about diets. Sorry to do this right after Thanksgiving, but you know, it's a topic. It's a topical topic. So here we are, and Jen has another question. Take it away.
Yes, hi. We had a call, and she is wondering what is the best way to actually, if you're starting out to exercise, what is the best way to start out, and with what kinds of exercises? She was in her mid-50s, again, and not real active, but looking to start things as that lifestyle change and looking for recommendations.
Do you talk to folks about exercise?
I do. I guess that's not necessarily where my specialty lies, so unfortunately I would have to refer her question to her physician or an exercise physiologist.
Everyone's different.
Exactly.
Right.
Yep, every body is
Obviously,
different.
walking is probably the least invasive, but
It's definitely, but you still want to get your heart rate up when you're walking too.
oh,
so.
okay, very good. Another question.
Yes, how different is iron in spinach compared to iron in red meat? And is one harder to absorb than the other?
Wow, that's a technical
That's an
question.
excellent question. Yeah, this is getting into the nitty gritty. I
Yeah.
kind of like it. So it's interesting that she brought he or she, excuse me, brought up red meat because red meat, iron from red meat is actually the most bioavailable, meaning it's the easiest for your body to absorb. Iron from spinach is still available, but it's not as easier for your body to absorb it. So both are very good for you, but it's easiest to absorb from red meat.
Huh, okay.
So.
Different chemical or makeup or something. Another question. Jen, you got anything?
I don't.
Uh-oh. Come on, let's get those phones
right
ringing.
now, but yes, call, please.
255-0121.
Well, maybe you have some questions
Yes,
for me.
I do. What about points and incentives? Smart points and that kind of thing that you hear in some diet programs.
Gotcha,
Is that a good way? Does that work?
It can be. So again, it's kind of like everything else. It's a tool. So if you're really incentive driven, that can be an excellent. Like if those points maybe work towards like a big reward, that can be excellent as long as it's not a food reward too. So.
And those are like from Weight Watchers and those brand name ones. Do you interact with those kind of organizations at all?
I don't interact with them personally, but I've worked with clients who have worked with these other programs. So like Weight Watchers.
Okay. All right. Now, Jen, we've got our phones back, and Jen is there.
We sure do. Steve just called in. He's wondering, he said his son works out a lot at the gym. He's wondering about adding creatine into his diet. And is there an age specificity for this?
Okay, that's something I don't know if I've ever heard that term before. So you can educate me on that. But what do you think about that? So creatine is some kind of, I don't know, supplement or something?
It's a supplement. I believe it's meant to either build muscle or help your muscles work more efficiently. I really don't know that there's a whole lot of, I don't know that there are a whole lot of studies behind these, so I can't, unfortunately, I can't advocate for or against.
And this is a person who is burning, we think from the call, burning a ton of calories, so burning a lot, and they have to replenish. So I guess that's what they're wondering about. There's losing electrolytes and all that kind of stuff. Jen.
Yeah, Jess from Albert Lee is calling in, wondering. She says she's used several online calculators to calculate what she should eat as far as calorie intake goes, and they all give her different answers. Is there some best way to figure that out, and if so, what is that?
Okay, so I guess what I use is it's called the Mifflin St. Yor.
Okay, Mifflin?
Mifflin, yep.
Okay.
Yep, so that's the calculation I use personally. At the same time, it's really easy for a layman or like a non-medical person. It's kind of easy to adjust. So I would really go to like a health professional in order to get your full answer.
Is that like an app or something that you get and you can get your information there?
Yep.
Okay, Mifflin.
Mifflin.
Okay, Jen.
Yes, Chris from Austin just called in, wondering how often do you know that people who lose weight, do they gain it back?
We touched on it a little bit earlier, but I don't know. We did.
So
many.
I guess
a lot.
Yeah.
I've heard studies about 96% of people who diet. We had it in the beginning of the program. Gain back after a certain amount of time. And that's getting in again to that long-term approach that you have to set your mind on that.
Exactly.
And we have a few minutes left. What about, there's another diet that I've heard about in the news, the Paleo Diet.
Yep.
What's that about?
Yep. So the Paleo Diet, from what I've researched, it's eat like a caveman. So that's taking a look at kind of what were the foods that we were predicted that the cavemen eat. So that would be like the fruits, the vegetables, and the meats. It's really taking away the dairy and the grains, just because.
Good idea or not healthy or? Everybody's different. It's
Everybody's
a tough topic
different.
to
Yep.
talk about.
Yep. I guess I really hesitate to take away food groups just because they all have their benefits. There's a reason that we recommend a full balanced diet that includes all of these food groups, just because they all have their benefits. They all have vitamins and minerals and your every other nutrient. Just the balance is really what helps your body.
Well, this has been very interesting, and I want to learn more. You can learn more by talking to Kjersten Nett at Mayo Clinic Health System. Thank you so much for joining us.
Thank you for having me.
Learned a lot. It didn't hurt at all, did it, about diet, learning about dieting. Hey, that's all the time we have for tonight. Our thanks to Kjersten from Mayo Clinic Health System. Thanks also to Jen and the RNs from Riverland who handled the phones and the email. Next week, we're going to talk about flu and pneumonia. Time to get that flu shot. What we know about the flu season coming, the effectiveness of this year's vaccine, how best to combat flu and pneumonia. Hope you can join us.